Welcome back to movementprofessional.com. So today I want to do an extension of a couple videos I've recently done about neck pain and shoulder pain. And I want to talk specifically about breathing and how it relates to neck and shoulder pain. All right, and one of the best ways to think about this is we're going to break the breathing process down into compartments within the body. So we can think about neck pain and shoulder pain as stuff that's up higher, obviously closer to the head. And instead of trying to break it down into what diagnosis you might have, is it a rotator cuff, is it a facet in the neck, let's just think broadly about there's more pressure up higher. So pressure near the neck, pressure near the shoulder. So what you can do with your breath is you can actually use it to move pressure into your body. And the better you get at controlling your breath, the better you get at controlling the pressure that you have in your body in any moment. So I want that to be the premise in which this video is based on. So we can look at different compartments of the breath. It all starts really in the middle here, where we think about where the rib cage and the abdomen intersect, right under there. So I'm putting my hand right under the rib cage here, but that would be a dome called your diaphragm. So your diaphragm is like your breathing muscle, and then right above that are your lungs. Now your lungs inflate and deflate more passively based on the muscle contraction of the diaphragm. So if we're going to start thinking about the compartments, so we want to think about how do we move the pressure as far away from the neck and shoulders as we can if that's where a lot of the stress is. So we can think of the compartment down actually starting low in the area of the pelvis or even the pelvic floor. So the pelvic floor would be basically the undercarriage area. So on the skeleton here, it would be right where this pole is running down through that pelvic floor. Now, there's not actually breathing musculature down there, but there's a cascade of pressure that happens whenever we inhale. What should be happening is the diaphragm drops down and creates a downward pressure. So we can gain control of that by limiting how much we use muscles that would pull the rib cage up in the neck and the shoulders, and focusing more on breathing from the diaphragm mainly, and just sort of limiting some of the motion that we get up a little bit higher. So this would be considered some version of belly breathing. I'll show some examples of how to think about that. Now, the idea of belly breathing is not really diaphragmatic breathing. It's really like an over-exaggeration of creating that diaphragmatic force downward. And it limits, in some ways, the inflation of the lungs upward. But it's a good place to start when you're having neck and back pain. And oftentimes it does calm the whole system down. It allows you to relax more than you would if you were feeling more pressure up higher. The pressure up higher in the neck and the shoulders tends to correspond to hyperventilation, more breaths per minute. And it's much easier if you're breathing down lower in the abdomen to slow the respiratory cycle down. All right, so I'll show some exercises there. So I'll show some ways to get pressure down into the pelvic floor, or think about getting pressure into the pelvic floor, because if we create this downward cascade, we're going to create a little bit of pressure on the internal organs. And the internal organs are really filled with fluid. There's a bunch of fluid there, so you can think about it as creating a smushing of the fluid pressure down, and then that's going to press down into the pelvic floor. And the pelvic floor muscles hang underneath. You can think of them as like a little bit of a trampoline. So then they get a little bit of a stretch if you create enough pressure down, so that the next exhale is a natural recoil. And then that recoil starts to move back upward, which assists in the diaphragm, which should just drop down with the inhale, coming back up into this sort of wedging or V-like position on the exhale. So starting with thinking about the compartment of the pelvic floor and then lower abdomen is a good place to start when we're trying to take pressure out of the neck and shoulders. If we can do that well and we start to really limit the amount of pressure we're getting higher, then what we want to do is start bringing the pressure up a little bit more, but not up into the neck and the shoulders. So we want to think about moving into the belly, and then what we're going to think about is these lower ribs moving wide, and this is called bucket handle breathing, where the ribs actually move outward like you're trying to take two opposing bucket handles and open them up. So I'll show you some exercises to work down lower, and then we'll start moving it up into these bucket handle ribs, and that's more of a wide type of breathing. Once we can control that, so we're thinking like we're filling the glass from the bottom up, then we can start thinking about the more the area where the lungs are, or these upper ribs. And what we want to make sure we're doing with the upper ribs is, as opposed to moving it up like we'd be breathing into the shoulders or moving the shoulders closer to the ears, which is going to create more tension in the neck, shoulders, upper back, we want to think about the ribs moving at like two opposing pump handles. So you can think of this sternum is going to raise up this way, and then on the back side, the space between the shoulder blades, when the back of the lungs inflate, that's going to sort of move this thoracic spine backwards. So we want to get a front and back type of motion. So then we'll have this full cylinder widening or expanding when we're inhaling. We're filling down lower, we're filling the belly, we're widening the ribs here, and then we're increasing the front and back dimensions up higher. None of that includes breathing up into the shoulders. So what happens quite frequently when there's pain is pain creates a stress response, which then creates a hyperventilation response. And that hyperventilation response actually changes the way we breathe. So we'll have a little bit of movement down into this diaphragm. The diaphragm always works with every breath, but it might just go down just a little bit, and then we'll pick up the slack by breathing up into the shoulders. And that actually, instead of making the belly move out or the ribs move wider when we inhale, it actually draws things up, and that's called a paradoxical breathing pattern. So that happens quite a bit, and it might happen very subtly where you're just keeping the breath up here and never really getting any motion down lower, but that's going to keep the pressure high, and that's going to lead to more pain at rest in the neck, in the shoulders. And it can also be tricky after doing some type of physical exercise where you did some upper body movement. There's some extra tension there, which is natural from lifting the body, but then you don't recover because you get back into your daily life, you're at a computer, you're at a screen, or you're just trying to rest, but you're not aware of your breathing. And if the breathing stays trapped up high, there's no recovery from the tension that you put in the body through the exercise that you did. So that's really important to just think about how the breath is basically a movement from the inside out that can be controlled, just like we can bend our elbows to get our biceps firing, or we can bend our knees to get our hamstrings firing. We get some control of this diaphragm, but it's not easy because it's tied into our nervous system, and we're going to have very ingrained patterns of how we breathe. So it's really important that we take some time to break this down. So we'll do a couple different exercises. We'll start with an exercise to get some motion down into the pelvic floor, at least to get a sense of how we can think about that. All right, so to get some pressure down into the pelvic floor, we need some feedback. We need some tactile feedback or some pressure so that we can get a sense of if anything is moving down there. So we can do this with a soft massage ball or a towel roll. The towel roll is a little bit more gentle. The massage ball is a little bit more pinpoint, which will give you a little bit more specific feel. So the idea is that we're gonna put either the towel roll or the ball right on that pelvic floor. It's helpful to sit on a bench where we can have more of this open straddle type sitting position. So I'll start with the towel roll. I'm just basically gonna straddle it, and it's going to be right between these sit bones here, and that's gonna be where the pelvic floor is. Now I'm gonna just plant my feet, and I try to stack my head over my shoulders, over the hips, and then I'm gonna slowly put my hands on my belly just to kind of help me think about getting things low. But ultimately what I'm trying to do is feel some expansion or some stretch into the towel as I inhale. So I'll inhale through the nose, I'll feel the belly expand, but then I'm also trying to feel some downward motion into that towel roll. Okay, and it can be quite subtle. On the exhale, what I want to feel is just a natural belly moves inward, but not a lot of tension happening. At the very end of my exhale, I may actively think about drawing the pelvic floor away from the towel roll so I get a little less pressure there. So I'm looking to get more pressure on the inhale, slowly filling up, thinking down, and then slowly exhaling. At the very end of the exhale, I may actively pull up a little bit. All right, so I can practice that with eyes closed or just really focus, sort of like a meditation, for about 2 to 5 minutes. It's very subtle, so you can try it with the ball. Sometimes the ball is really sensitive. That area can be very sensitive, so it should not hurt, but you use whatever you feel you can to give you a little bit of feedback for that motion downward. All right, and the pelvic floor is not always the best place to start. I'm sequencing it this way just to get a sense of lower is the goal, but sometimes it's really hard and really subtle to feel motion down in that way. Sitting upright tends to be the best position to get this feeling or this pressure down into the pelvic floor because gravity is assisting, right? You can think of it as a downward pressure from gravity. It helps. So the next area we're going to look at is the low abdomen. So we can think of like belly button area. So we have two different options depending on if we want to be face up or face down to work on this area. So I'll start face up. It tends to be the least threatening, but you tend to need to find the right kettlebell to work here. So if I lie on my back, yeah, my legs straight or even bent. A lot of times straight works better because you really just let yourself go. And I'm going to put the kettlebell handle flat right on my belly button, or it can be a little bit above that. All right, so I'm getting this idea of pressure low, and then the idea is when I inhale, I'm just going to lift the kettlebell up. I also want to think about the lower back moving into the ground, and then when I exhale, just let the bell sink in. Okay. And I want to just slow my breathing down, so it's slowly in. I can feel the bell lift up. I can hang out there for a little bit, and then slowly out. And the exhale should at least be even with the inhale, if not more. And the exhale could be substantially longer. Sometimes if you really just let this go, you'll feel a pulse, which is just a little bit of pressure on your abdominal aorta. And that'll just give you a sense that you're really, really letting go. So you can kind of find that pulse and count it. And then breathe back in. When you breathe in, that pulse should go away. Okay, so another 2 to 5 minutes there, really allowing yourself to let go. If you want a little bit more pressure, you go soft ball right on the abdomen, just a gorgeous ball right on the belly button again. So a little less pressure if I'm propped up on the elbows. I'm doing the same thing. Feel my belly pushes the ball out of me on the inhale, exhale, letting go. Being really sure, especially if I have my arms like this, that I'm not inhaling and bringing my shoulders closer to the neck. The neck is just relaxed here. All the pressure is lower into the abdomen. Okay, and then if I flatten out, I get more pressure. Same idea. My head and shoulders may be more relaxed here, but it's more pressure into the ball. So if you can do both positions just because you want your body and your neck and your shoulders to get more comfortable in more positions. All right, take this slow because it can be alarming to put pressure in your abdomen. There's going to be a natural threat response to your nervous system to be putting anything near the organs. But if you do it over and over again, your body adapts to it, and it actually can become quite relaxing. All right, so that would be how we're going to work on that lower abdomen position. Now we're going to look at some exercises to work on the bucket handle lower rib position. So for that, we're going to use a band that goes 360 degrees, and I'm going to step into it like I'm putting on a pair of pants. Get it up right around the lower ribs. If I can make it broader, it's better. And actually a little bit more of a snug band will give me more feedback of am I actually moving from where I want to move from. If there's not a lot of tension in the band, you usually don't get a sense of that it's compressing down, so you're not going to get much feedback. All right, so I can also use my hands right on this lower rib area with the band, but I like the band because it creates this 360 degree idea. So although the focus is really to go wide with the ribs, if we can feel a little bit of movement forward and backward too, that's ideal. So we're trying to create this 360 degree movement of the ribs. So now the inhale will be feeling the band spread, and then when I exhale, I feel myself get a bit more narrow, still trying to go for longer with both the inhale and the exhale. So I can do this one in standing, I can do this one lying on my back, I can do it prone. Side lying works well for this position because we get this sense of this top side rib can move up to the ceiling, bottom side rib goes into the ground, exhale, gravity helps a little bit to move this down, and you can do that on both sides. Any position works. If you're not feeling a lot of movement in the ribs, try different positions. Try side lying first. It could be one of your better ones to get that feeling of motion. And one of the ways to look at this is we're trying to work around neck and shoulder pain. And a lot of times that neck and shoulder pain is going to come on when you're sitting or when you're upright, just because that area is very postural. It's being used to hold your posture up. So if you lie on your back, if you lie on your side, if you lie on your belly, you're changing your relationship to gravity. So that gives you a little bit of a rest. So you get this benefit of moving pressure down lower, but you're also just getting the benefit of changing the activity of the muscles that they have to use all day when you're holding your head up. Okay, so that's going to be how we work on the bucket handle. And then when we look at the pump handle, this one's a little bit trickier. There's a couple different ways to do it. One of my favorite ways would be to use this ball again. Now we've mastered the lower belly breathing, moving the ball into the belly. So now we can just roll this ball up onto the chest. So I like doing this typically on a bench, so I'm not as extended, flat and prone. So like the bench allows me to do this in more of a quadruped or kneeling position. So I can still create this pressure here, but I can also have my hands able to push into the ground a little bit or reach in a slightly different manner. Okay. And there's a little bit less pressure here on the neck when I'm in this position versus if I was totally prone. So I'm going to just put this right on the sternum, find where there's the most pressure. Often helpful to create like a little bit of a pelvic tilt, just so I'm thinking about aligning the back of my belt with the upper back, and then I'm going to slowly inhale. I'll feel the belly fill first, and then I'm going to feel the chest move into the ball. So just like I was moving the abdomen into the ball on the inhale, when it was lower, I'm moving the chest into the ball. And then when I exhale, I deflate and I let the ball move into me. And then I'm going to repeat. And then I can do this with different arm positions. Reaching up overhead a little bit may create a little bit more of a lift of that sternum. Okay, it can also be useful to start messing with some arm activities where I'm actually going behind the back. As I'm reaching, I'm breathing in. As I'm exhaling, I bring the arms down, because this shoulder extension can couple with the sternum moving forward that way. So that would be how I'm going to look at working on the front pump handle. And then if I was going to look at the backside, I'd go back to the pinky ball and I'd put this right here. Think of an alleyway between the spine and the shoulder blade. And I could pick one side. I can have two balls and do both at the same time, but I like to do one at a time because there's usually a difference in feel. So I'm just gonna find that alleyway. So arms could be out to the side, they can be a little bit overhead. Head's gotta be supported on the ground. And then I'm gonna just try to do a little tuck so I flatten my spine into the ground. And I'm going to imagine that that space between the shoulder blades is opening. And then I'm gonna inhale and think about the back of the rib cage moving into that ball. Exhale, I get heavy, 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 heavy into the ball. Again, stuff can be quite subtle, so practice. It's unlikely that anything's gonna make you worse when you're doing this stuff. It just might feel a little bit frustrating at first. I guarantee it gets better with practice. I've experienced it myself, and with many clients. It's just you have to respect the idea that you're moving pressure throughout the body. All right, so those would be all the compartments that we're thinking about with breathing. We're talking about neck and shoulder pain, but really most pains in the body are helped if you can get better control of your breathing, because you're really just trying to take pressure from one area and move it to the other. So if you get really good at that, you can be calming your nervous system down, but you're literally mechanically changing the pressure in your body in that moment, which will oftentimes change the feeling of discomfort in that moment. Hopefully that makes sense. I know there's a lot there. Please feel free to ask questions, and I'd be happy to get back to you. I'll see you next time.